Dr. Sarah Ernst here of the Ask Dr. Ernst Show on News Talk 1110 WBT every Saturday afternoon at 3 o'clock. I'm excited to join you here today because we're talking about thyroid disease. You know, a lot of symptoms that people are experiencing that have thyroid disease are like moodiness and irritability, weight gain despite diet and exercise, brain fog, and just feeling lack of energy consistently. You know, 27 million Americans are dealing with a thyroid-related disease, but only half are being diagnosed. It's actually the #1 endocrine disorder in the United States today, and it is actually one of the most common factors in weight gain. You know, a few myths that I want to bring attention to today are, #1 is that a lot of us think that going on hormones or receiving medication is the best way to fix your thyroid disease. Unfortunately, it's not. You know, our thyroid hormone, which is called T3, is our active form. It helps us have energy. It helps us be less moody. It gives us less brain fog. It helps us to lose weight. That T3 is necessary for our body to be able to have that energy and weight loss. The problem is with medication is we're given a different form of the hormone. We're actually given a form called T4. T4 is the inactive version of the hormone, which means that our body has to take T4 and convert it to T3 in order for us to feel good, lose weight, have less brain fog. We have to have that conversion take place. So if you're taking the medication, but your body can't convert it, typically what happens is that you'll still have your symptoms even after taking the medication. So taking medication is not the best result. Do you really want to know how to get rid of it? Do you want to know the cause? Well, it's not just about even looking at the blood tests. You know, a lot of times looking at blood tests will maybe even show us that you look normal. Maybe your doctor's told you, well, everything looks fine on your blood tests, you're fine. Maybe it's all in your head. Maybe you've been told that. You know, it takes about 10 to 20 years before your blood test will show something normal, for us to show a disease in the body, which is really scary. You know, I wouldn't want to wait that long to find out if something's going on in my body. And the other thing is that there's lots of different tests that your doctors are not running. You know, the gold standard, what we've been told, is TSH. Tells us exactly how our thyroid is functioning. Unfortunately, it's not. It tells us that lab normal ranges it too. We look at functional ranges. We have to see how well your body is functioning functionality-wise. How well is your thyroid functioning? And in that case, we have to look at several other factors. Is your body in an autoimmune state? You know, 80% of thyroid-related diseases are autoimmune. So we have to find out if we're doing the right tests. We have to see if your body is even using the right hormones. So right now, we have an offer for you to attend our next event. Do you want to know if you have a thyroid-related disease? Do you want to know if you actually have an autoimmune-related condition that maybe that medication's not even doing anything for you? Do you really want to know what the cause of your thyroid problem is? Well, you have that opportunity. Register for the next event and we will get you that information. We will get you the answers that you deserve. I'm really looking forward to meeting you.